Moving on to the next session, that is occupational dermatosis, our experience a step further. The speaker for this session is none other than Dr. Iffat Hassan. And I would like to invite Dr. Kishor Singh sir and Dr. Venkat Mysore sir for chairing the session. Dr. Kishor Singh sir is the currently professor and head of the department at Department of Dermatology at NIMS Medical College, Jaipur. He has a great teaching experience and has worked as grade specialist at Base Hospital, classified specialist at 92 Base Hospital and Military Hospital. And he has also worked as associate professor at AFMC Pune and MGMC Jaipur. Dr. Venkat Raman Mysore sir is specialized in dermatopathology, and he has a teaching experience of more than 20 years and 13 years of undergraduate and postgraduate teaching. May I please request you, sir, to invite our speaker, Dr. Iffat Hassan, ma'am.
Thank you, Dr. CV, for introduction. Without wasting time, I invite Dr. Iffat Hassan to deliver her talk on occupational dermatosis, our experience a step further. Dr. Iffat, please.
Is the screen visible now?
Yes,
Yes,
yes.
ma'am.
Okay. A very good afternoon to all of you. This afternoon, I'll be sharing our experience with occupational dermatosis. No conflict of interest and no financial disclosures to make. We all know that occupational dermatosis is any alteration of the skin mucosa adnexia, which is directly or indirectly conditioned, maintained, or aggravated by agents present in the work activity or the work environment. And in industrialized countries, occupational dermatosis contributes to 60% of the occupational diseases. If you go by the history, Hippocrates in his work Affections mentioned that when you go to a patient's house, you may ask some pertinent questions like how many days he has been ill, what food he eats. But it was Bernardo Ramazzini in his Discourse of the Disease of Workers in 1700 when he said that we should ask one more question: what occupation does he follow? And this is a very pertinent question because this can give you a clue to the occupational disease that a person can be having. Like we all know, in 1775, Sir Percival Pott, like it was the first case of scrotal cancer that he noticed in chimney sweeps in England as chemical carcinogenesis because of the chimney soot. So it's very important that the occupation should be asked. If we come to occupational skin disease, contact dermatitis accounts for 90% of occupational skin disease, and the majority of it is irritant contact dermatitis. In Asia, up to 30% of all occupational disease involve the skin because the majority of the workforce is in the unorganized sector. However, in India, Pakistan, Thailand, occupational allergic contact dermatitis has been reported to be more common than irritant contact dermatitis if we compare to the West. Now, coming to our experience over the years, like we started our contact dermatitis clinic around 10 years back in 2011. And we started with looking for contact dermatitis in saffron workers. This was the occupational group that we studied first and looked for contact sensitizers in them. We studied an area in Pampur that is around 11 kilometers from Srinagar. And it was a work size study where we looked for the workers in the fields. Then we are fortunate enough to be blessed with the largest tulip garden of Asia. And we worked on the tulip garden and examined the workers there and looked for contact dermatitis due to tulips and looked for tulipalinae and so on. Then we worked on cottage industry workers, veterinarians and veterinary workers, and then on food handlers. Now, moving ahead, now what has been our experience after we studied these occupational groups? So one of the groups that we studied was hospital employees in our hospital. And we studied around 340 employees. This was well before the COVID pandemic. A questionnaire was circulated, and we also did a complete cutaneous examination wherever relevant. We did patch testing with the Indian Standard Series. A total of 340 employees were screened, and there were more of males compared to females. And this was the designation-wise stratification of the study population. Doctors were more in this group in the study population. They outnumbered all other groups of workers. And we found this was the type of eczema that we observed in them. Wear and tear eczema in 17, followed by discoid eczema. And these are some representative photographs of our hospital employees. This was a resident doctor with ring eczema with a negative patch test. And we found that atopy was also common in some group of the patient. There was a background of atopy, and this was the patch test profile in our hospital employees. And we found that our prevalence of hand eczema was much higher than what has been reported in other outpatient departments in our country. And the strong association with atopy in our study, it was found to be the most important underlying cause predisposing to hand dermatitis. And this study was published in IDOS this year. Another group of workers that we studied was sericulture workers in our valley. And sericulture, we know, happens these workers due to exposure to various pesticides, manual handling of cocoons, and immersion of bare hands in hot water during cocoon processing. The workers have an appreciable risk of developing a myriad of skin disorders. If you see the stages of like the life cycle of like how butterflies, these are the changes. You have eggling on the mulberry leaves, then the larva is formed, pupa, then we have a cocoon that is shed, and from the cocoon you have the pupa which turns into an adult butterfly. And these workers handle silkworms with bare hands, and they also are involved in gathering of the cocoons. So these are the two stages, the larval stage, because the silkworm mainly feed on the mulberry leaves where the workers come in contact with them, and then in the cocoon sorting and the pupal stage, the workers come in contact with them. We didn't focus on the other areas of silk production, just we focus on these two steps. What we did is we did this study in collaboration with College of Temperate Sericulture, which is a part of the Sher Kashmir University of Agricultural Sciences in Srinagar. And these are the mulberry farms. This is a mulberry farm in Mirkund on the way to North Kashmir, like it's 18 kilometers from Srinagar. And we took a sample size of 140, and commercial extracts of silk allergens were not prepared, so we made crude extracts of patch test like antigens. And we made an allergen extracts from silkworm cocoons and from silkworm pupae. This is one of my students, Dr. Shanawaz. You can see it on the right hand upper hand corner, visiting these, doing field visits and visiting these farms. And these are his photographs with the workers involved in sericulture. You can see on the right hand side on that tray, you can see the silkworms. And on the trays, these are again containing the silkworms. So what did we see? We found that eczema primarily affected the thumb, index finger, and thinner remnants of both the hands. About 140 out of 140 workers, 34.2% of the workers were suffering from eczema of varying severity. Patch test positivity shows a significant association with the presence of eczema in the worker group. And the incidence of overall allergen sensitivity was 29.3% in the worker group and 8% the controls. Controls, we took 50 controls who were not related to sericulture work. These are photographs of some of our patients. So the workers who were mainly, the number of workers who tested positive patch test were more who were involved in cocoon reeling, and followed by cocoon boiling, and followed by worm rearing and cocoon sorting. And this was the positivity of the patch test reaction. So a direct relation, but however, a direct relation between the type of work and skin reactivity could not be established. And a higher percentage of subjects engaged in the process of sorting the cocoons were sensitized to silkworm-derived allergens. So another group that we studied was the workers involved in the fruit growing industry of Kashmir Valley. The valley is often known as the fruit bowl of northern India. The climate favors cultivation of lots of fruits and dried fruits like almonds and walnuts. But workers who are associated with this cultivation are exposed to a variety of irritants like manures, fertilizers, pests, and so on, and also to intense sunlight. In this study, we studied 700 workers who were involved in this industry, and a detailed history and examination was taken wherever deemed necessary investigation were done. We calculated the sample size depending on the area under which the fruit was calculated. And if you look back at the stages in the development of a fruit tree, in the apple tree in the initial years, you have a lot of grafting and other things that needs to be done. And the workers are involved in spraying pesticide, and these are the pesticides that they commonly use, then harvesting of the fruits, and then packing them. These are walnuts in full bloom. So you can see the green thing that are the raw walnuts. This kernel has to be removed to take out the walnuts, and this walnut is then dried. And but here you can see in the left hand side the picture, you have the black thing on the worker's hand. That is the staining is because of gigolone present in the green part of the walnut kernel. Cherries, then pear orchards. And this was my student, Dr. Yagzita Bashir, who went all across North, South, and Central Kashmir. It was again a worksite study. What we found that there was a male preponderance in this study, and skin lesions were present in only 276, and the proportion of non-infectious lesions were more common compared to infectious lesions. And among the fungal infection, onychomycosis was the most common. In the infectious lesions, in the non-infectious lesion, we found friction-related injuries to be more common. It was also seen, if you see the number of years that the workers spent in the industry and the skin lesions observed, there was a direct correlation. And also between the use of pesticide, insecticide, farmyard manure, cow dung, fertilizer, all had a direct high prevalence of the disease. And those who didn't use protective measures were more affected compared to those who did use protective measures. These are some of the patients, and you can see again the different non-infectious presentations. And this was the positive patch testing which we found in these patients. So the higher prevalence of fungal infections which we saw in our patients of fruit growing industry can be attributed to factors like working in hot humid condition, use of rubber boots, and farmyard manure. And among the non-infectious dermatosis, friction-related injuries could be attributed to several factors like plowing, tilling the soil, shoveling, hoeing, and so on. Another occupational group that we study were the paddy field workers of our valley. And these workers are also exposed to a variety of agents like manures, fertilizers, pesticides, besides getting exposed to lots of sunlight for long hours due to the nature of their work. This is a full grown paddy field in our valley, and these paddy grains are then spread in the fields after threshing for allowing them to sun dry. In this, we studied around 600 workers, again a worksite study. And we found that 230 workers had skin problems, where the others were free of any skin problems. And infections, non-infections lesion again predominated. And you can see here among the infections, you had pitted keratol. Non-infectious lesions included melasma, followed by hand and foot eczema, and hypokeratosis of palms and sores and callosteal or cuts. Among the infection lesions, the major chunk was formed by bacterial infections, followed by fungal, viral, and parasitic, and pitted keratolysis and intertrigo was more commonly seen. And melasma was quite common in these workers because of long hours of exposure to the sun, followed by hand and foot eczema. And again, there was a correlation between the number of hours spent on field per day and the frequency of the skin lesion, and also between the use of fertilizers, manure, cow dung, and the occurrence of skin lesion, and also the use of protective measures. So this is some of paddy field workers with pitted keratolysis of the soil, creeping eruption in a paddy field worker, onychomycosis, melasma. So So another group of workers that we study was hairdressers and beauticians, and we studied 100 hairdressers and beautician working in 57 saloons and beauty parlor located in Srinagar. And patch tests were performed with the Indian Standard series, and we found three patterns of eczema. One was a classical hand eczema, then an interdigital eczema, especially those who are using like working with shampoos and spa treatment, and then a threading type of eczema because of the constant, like the thread twisted around the index finger and threading procedures. And callosities was another important feature that we found in these, and we colloquially termed them as Scissor Nodules. And then we found staining of the distal portion of the nails. This is on the left hand side picture, you can see this is what we called as the Scissor Nodules, then hand eczema and staining of the distal portion of the tip. And on the right hand side, you can see this we called as threading eczema. And these were some of the patch test positive photograph. These two more studies I'll discuss. These are still going on. This we studied printing industry workers of Kashmir Valley. This is there's not much work that has been done anywhere on this. You know, during printing there are three step: a pre-step, then a step procedure, and the post-step this procedure. So, and these workers are involved in are exposed to a lot of chemicals and dyes and also glues. So till now we have worked on 150 workers, and in these we found these were our results so far. Acne being very common, contact dermatitis we could see in 43, and frictional and traumatic injuries were quite common. So this is one of my students, Dr. Shahab, going to various printing presses, and you can see this traumatic arm injury also with post-traumatic scar in these workers. Another group, this is also, we are still studying our automobile repair workers in our study. Again, work on this is very minimal. And these workers also exposed to lots of uh, like greases and lots of expose a lot of irritants during their job. And currently we've seen around 70 automobile workers, and traumatic and friction injuries were more common in them. These are my two students. On the left hand side, you can see in the picture below is Dr. Akib, and above is Dr. Shahab. They are still collecting this data, and maybe in future we'll come out with more representative data. So projects which are still going on are occupational dermatosis and fish farm workers, and occupational dermatosis and poultry workers. So the take-home message from my talk is information and better knowledge of the occupational dermatosis is important in devising strategies to improve the health scenario of workers engaged in different occupations, and simple measures like proper use of instrument, use of protective gloves, guarded use of chemical and hand washing can be very beneficial in reducing the burden of health problems in these workers. Thank you.
Thank you so much, ma'am, for enlightening us with such a great talk.
Thank you, Dr. Iffat, for your interesting and educational talk. Thank you so much. I thank also my co-chairperson, Dr. Venkat. Thank you.
Thank you, Dr. Ishat. Your expertise in occupational dermatosis is well known. Your oration which you gave in a ADVL Dharmakon is still very remembered. Thank you so much. And I thank Dr. Mathur for inviting me. And also I appreciate and admire his zeal for holding such conferences. And hopefully next year we will be in Jaipur for one conference as that. Thank you so much. Good luck, everybody.
Thank you, sir.
I would like to thank the chairpersons and the speaker for this session.